Here's the audience. Thank you. Okay. In the United States, the number of citizens experiencing the loss of a limb is expected to more than double by the year 2050. So that number is rising from 1.6 million reported in 2005 all the way up to above 3.6 million in the next 30 years. Obviously, these patients are going to require extensive therapy and education from a team of healthcare professionals. And today we'll be looking into see if OT practitioners should be part of that interdisciplinary team when treating lower limb amputations. The first thing we'll look at is the interventions provided by OT practitioners in these types of cases. So OT practitioners work with these clients throughout their lifespan in order to successfully participate in their most meaningful activities of daily living. So all of the interventions that we will provide are directly related to a client's performance of functional tasks. There are 4 therapeutic stages for treatment of lower limb amputations, and we'll take a peek here at the intervention examples provided within those stages. The first therapeutic stage is the acute stage. Here, OT practitioners will provide range of motion, wound care, looking into things like psychosocial support, and goal development. Pre-prosthetic and basic prosthetic training are kind of lumped together because this is where the client will see their OT practitioner most frequently. This is where a client will work on rebuilding the skills needed to accomplish their most important tasks. So this will be seen through therapeutic exercise, edema control, muscle strengthening, and educating the client on the body mechanics that they'll need to actually use their prosthetic once they do have it. And OT also looks into the competence of the client to ensure that they are understanding those precautions that they need in order to be successful with the use of the prosthetic. And finally, the discharge stage. Here is where an OT and an OTA will essentially work together to ensure that the client is leaving with the resources and the education they need in order to be successful. So we want to make sure that they're successful in their self-cares, their job activities, leisure activities, things like that. So many people mistake occupational therapy with physical therapy. And although there is some overlap within the interventions that they provide, there are some differences, and here we'll take a look at what those differences are. Physical therapy's main focus of intervention is related to gait patterns, balance, lower extremity strengthening, and supervised walking. Success of these treatments relies heavily on K-scores. If you refer to the figure there, you can see that K levels range from level 0 to a level 4. So a level 0, the patient is essentially unable to ambulate independently or with the use of a prosthetic. Versus a level 4, it's pretty much your highest form of independence, and the client will be walking past the basic skills needed. The difference here is success for occupational therapy goals is heavily reliant on the independence level and function of the client within their occupation-based tasks. So where PT focuses heavily on ambulation and gait patterns, OT is more focused on independence levels and performance. All right. Rehab after a lower extremity amputation can be divided into 9 specific stages. And here we're just going to take a brief look at the stages and the OT involvement within them. Stage number 1 is preoperative. Essentially, this is just the duration of time before the patient's amputation operation. Here, OTs will focus on goal writing and comorbidities, especially depression, that's pretty prevalent within these clients. Second is amputation, surgery, and dressing. An OT will not be involved in this stage. It is the stage of the actual surgical procedure and dressing and wound closure. 3 is acute post-surgical stage. Okay, here. It begins immediately post-operation, and OTs will focus on pain management, range of motion, and promoting wound healing in order for the client to be functional through mobility training. Residual limb shaping and stump shrinking is stage number 4. OT is actually heavily involved within this stage. They focus a lot on skin and wound care, increasing that range of motion, and training the client on functional mobility without the use of their prosthetic. So this is before they're even given their prosthetic to begin with. Which leads you to number 5, the actual prosthetic prescription and fabrication. Although OT's role is slight, this is the stage where the healthcare team is going to work together to decide what prosthetic is best for this client. So any anything that an OT might see during their interventions thus far, their input is important when deciding what prosthetic to choose. This leads you into prosthetic training, which is stage 6. This is where you will teach the client how to manage their prosthetic and the actual use of their prosthetic. So an OT will work with a client through this stage by basically just incorporating the use of their prosthetic into their interventions. Community integration is stage number 7. So this is where the patient is resuming their previous roles within their life, within the community, and therapy interventions have been working up to this. So although an OT might not necessarily be directly involved with community integration, everything that they've been doing with the patient thus far has been leading up to this stage. Next, we have the vocational rehabilitation stage, and this is essentially just assessment and training for job requirements. So at this point, a patient may not still be in the hospital, but they may be seeing an OT in an outpatient clinic through work hardening or work conditioning programs. Follow-up, an OT will not likely be involved, but it's just the focus of the client's lifelong journey with their prosthetic. With all of that said, here are my recommendations to you when developing an interdisciplinary team for a client with a lower limb amputation. You want to promote communication and collaboration amongst all of your team members. You need to assess the scope of practice of each member of the multidisciplinary team to determine specific goals, and ensure that all members of the patient's healthcare team are on the same page in terms of approach to treatment. You also need to take a holistic approach to treatment and incorporate client-centered goals. Ensure that all realms of function are being addressed with the treatment team that is chosen, and guarantee that the following things are addressed: the client's physical functioning, mental health, functional mobility, wound and pain, compensatory strategies, and modifications, including the use of adaptive equipment. Any questions? Okay, thank you.